Joining us now with more on these safety precautions, Robin Kaler, the Associate Chancellor and Director of Public Affairs. Robin, thank you for joining us.
Thank you for having me.
Well, let's start with the basics if we could, because people are talking about colleges coast to coast. Let's see what U of I is planning to do when they get kids back on campus or keep them at home. What's the plan in Champaign?
So it's a blend. We've offered students the option. You can either come back to campus if you want, or you can work remotely. If you come back to campus, though, you have to agree to earn that privilege, if you will. So there are things that we're asking students to do. The obvious ones about wearing facial coverings and observing social distancing and that sort of thing. And one we announced today is that you need to be willing to undergo testing for COVID twice a week throughout the semester.
So that testing twice a week is pretty aggressive compared with what other folks are doing. But one issue that's been cropping up is how long it takes to get those test results back and whether or not people can be an asymptomatic spreader during that time. What are you all doing to combat that lag time in testing?
So our researchers have developed a test that turns around very quickly. It's a saliva-based test, so it does not involve the nasal swab that so many people are not comfortable with. And I went Friday and got a test, and I got the test at about 11:30 in the morning, and I had my results by about 2 o'clock in the afternoon. It turns around very quickly most of the time. Obviously, occasionally there are reasons that it has to be rerun or something like that, but a lot of the tests are turning around in 5 hours or fewer. So that's been really helpful. And we also had other researchers who did a lot of modeling to see what that time range needs to be. And you're exactly right. You've got to make it fast enough and get the results fast enough that you can act and isolate people when you need to.
That certainly matters at a school of your size. That takes us to our next question, however. What happens when those tests come back? If there is a positive, if it is positive, what is the plan at U of I for kids, staff, whoever who does test positive? How do you handle that on campus?
So if you are a student and you live in a residence hall, we actually have set aside several hundred rooms in the residence halls for quarantining or isolation. If you don't live on specifically on campus, it's just like anyone else in the state of Illinois. You're asked to stay in your own home. If you live with other people, stay in your bedroom, that sort of thing. And then obviously if you're symptomatic and you need medical attention to go seek that immediately.
Robin, we only have a few seconds left. How do you avoid having kids who are at college congregate, whether that's a fraternity party or a get-together in dorms, etc.?
Yeah, actually our community, Champaign-Urbana, the mayors and the public health district locally have been amazing. We've all been working together, trying to see what sorts of limitations and responsibilities we all need to share as a community to make sure that that doesn't happen. And again, for our students, specifically, if they don't observe those things, they lose the privilege of being on campus this semester.
Enforcing it will be interesting. Robin Kaler from U of I, thanks for joining us this evening. A lot of good insight. We'll see if things change between now and the time they go back. Many thanks.